Hi, and welcome to our new show, Aging Matters. I'm Sharon Coleman. We're going to be discussing different aspects of aging, such as home care, financial health, and mental health. Starting off today, we have Frank Samson from Senior Care Authority to discuss senior placement. Welcome, Frank. Great to see you.
Thanks, Sharon. Thanks for having me.
Now, let's talk a little bit about long-term care, because that's a fairly broad topic.
It is, absolutely. Well, you know, there's different types of long-term care, and actually in-home care is part of that, where someone is coming in to help take care of a family member at home, maybe with what we call activities of daily living, ADLs, and you know, could just be help with transferring, taking someone on errands. That is still long-term care. Where we come in as an organization, if someone really can't be safe at home, or it's just the dynamics of the family or the logistics make it so it's just not the best place for that person to be. So we try to help people find the right place to live. And then those options could be assisted living, which I know we're going to talk more about, or nursing. You know, our emphasis is more on the assisted living side to try to keep people out of nursing. There's certainly a place for it, though.
Well, let me ask you a question. I'm wondering how somebody is walked through the process. Let's say, for example, I call you and I'm concerned about my father, let's say.
All right.
What happens next? Well,
what we'll do is we'll initially do a phone assessment. So there's a series of questions that takes, you know, could take anywhere, even up to a half hour or so, but just understanding more about the family situation and your father's situation.
Like his health needs?
Exactly right.
Okay.
Exactly right.
How mobile he is.
Right. And then, if it sounds as though you are interested to say, yeah, I think looking at maybe some assisted living or residential care could be an option, you know, for my dad. I'd like, you know, let's go look, and we'll actually set up appointments and go with you, just like a real estate would go with you to go look at homes, and so we'll set up those appointments. We'll make sure that we have the right fit, because we've seen all these homes. And not only have we seen them, it's not even just the place itself, but we need to know what your father likes, his personality, and what type of place would be the right fit with the other residents. You certainly don't want to put someone who really has it together to be somewhere where maybe people need a lot more care. You want to have the right mix. And so we'll help all the way through that process, even helping negotiate the best deal we can, and ongoing follow-up and paperwork.
I think that's fantastic. I really like the idea that you literally are walking someone through the process, as opposed to, here's a list of places that you may want to call.
Yeah, no, right, and that's the important thing, because one thing for sure is when we get that call, whether that call's coming from the family member or the call's coming from a hospital referring us to a family member because of a discharge or something, that family is under a lot of stress.
Yeah. Oh, of course.
It's very emotional. It's difficult, and what we're trying to do is to eliminate that stress. Someone who is going to buy a home, they call a real estate agent. Someone who's going to go get stock, they call a stockbroker. But a lot of people aren't aware that if they're looking for long-term care options, they don't know where to turn.
And there's someone to call.
Yeah, exactly right.
Well, with regard to senior placement, which is a pretty broad topic, I'm wondering really what the difference is between a nursing home and assisted care or assisted living, because they're used interchangeably.
Well, the people look at them as one and the same, and they have for years, but they're really quite different. I'm really thrilled you asked me that question, because nursing is really geared for people more for rehabilitation, maybe after being in the hospital for a stay. Those that stay in nursing homes long term, all right, is someone who really needs a lot of medical attention. They may have feeding tubes hooked up to them, and they, you know, that type of scenario is not appropriate.
Right.
Nor is it our residential care homes and assisted living locations licensed to handle someone like that. But they certainly could handle someone with dementia or Alzheimer's and other issues and transferring and guidance and supervision.
And again, that's something that you kind of help someone navigate.
Absolutely right. You know, we're kind of a matchmaker in a sense. We understand more about the person, the family needs, the budget, everything that goes with it, and just find the right type, the right place, and make sure number one is safety. You know, we want to make sure that that loved one is safe.
Well, let's talk about a really important issue, which is money.
Right. Right.
What are we looking at in terms of costs? Is anything covered by insurance?
Well, the cost for assisted living is private pay. Okay.
Oh, okay.
However, people can get money from a couple different sources to help pay for that. One is long-term care insurance.
Oh, okay.
All right.
Okay.
Unfortunately, I think those that are elderly probably, many don't have it. Statistics show only about 7% have it, but more and more people are getting it. If someone was a veteran, and there's some requirements. We don't have to get into the details right now, but we'd be happy to answer questions on that. Okay. Or a surviving spouse of a veteran. There's money that can be had there. The Veterans Administration provides, called Veterans Aid and Attendance. Other than that, it's really private pay. Medicare does not cover that. So Medicare would cover something if somebody had to be in a nursing home for short term for rehabilitation. Medicare does not cover someone to be in there long term. That's where Medi-Cal would kick in. Okay. Okay. If someone,
and if they meet those financial requirements,
they would have to meet those financial requirements.
Well, how about your service? What are we looking at in terms of that? Because obviously, tremendous resource.
I know people sometimes don't believe it, but we don't charge anything for our service. And the reason we set up the model very similar to like a real estate agent. So if you're going to a real estate agent to go find a home, you're not paying the real estate agent anything because they're getting a commission back. And ours works the same way. But we set up agreements with the assisted living locations and throughout the Bay Area, and we've gone and visited them. We even rate them. We even have a rating system for them. So we share that rating system with our clients.
Now, are you only within the Bay Area, or let's say someone was talking to you, they live in the Bay Area, but a family member maybe lives somewhere else?
Yeah, what we've done is we have our own advisors throughout the Bay Area, even all the way up into the Sacramento area. In other areas, including Southern California, we've aligned ourselves with like companies that we feel provide a good service. So we have affiliates that we work with in those other areas.
So you can refer.
So if a family member, if an adult child has a parent that lives elsewhere, feel free to call us and we'll be happy to give them guidance on that.
Now let's say me, for example.
Okay.
If just in a general way, what would you tell me to do if I'm thinking in just little baby thoughts about placing a family member, a loved one, in assisted care? What kind of advice can you give me? Well,
the thing about it is just to understand the options, all right? Because should that time come, all right, that you're looking at for a loved one, at least you understand better what the options are. And you could concentrate more on your parent and their needs than to worry, all right, now what do we do? At least you know what the options are. So we would love to talk to someone like yourself to call us,
you don't want to have it to be
understand
crisis mode.
Right. And I have to say, in the majority of the cases, we're in crisis mode.
Frank, thank you so much.
You're very welcome. Thanks for having me.
This is a great talk. We need to go right now to a quick break, but for more information about Senior Care Authority, or if you have a family member that's in need of care, call 866-717-2477. We'll have more when we come back on Aging Matters. We'll be right back.